What if everything you believe about blood pressure is wrong? For years, 120/80 has been called the perfect number. Doctors repeat it. Patients trust it. But new research is revealing something deeply concerning. For seniors, this ideal number may not protect you. It may actually put your life at risk. Dizziness when you stand, sudden weakness, dangerous falls, and sometimes consequences that can't be reversed. Here's the shocking truth. Many older adults are being pushed toward this number without anyone asking if it's right for them. So the real question is 120/80 helping you or quietly harming you? Before we reveal the right number, you need to understand something important. Blood pressure is not one size fits all. What works for a 30-year-old can be dangerous for someone over 70. And yet, many guidelines still treat everyone the same. That's where the problem begins. Because your body changes with age. Your blood vessels, your brain, even how your body reacts to medication. So, instead of chasing a single number, we need to ask a better question. What blood pressure is actually safe? For you, let me tell you about Eleanor. She was 78 years old, active, independent, still living on her own. At her last checkup, her doctor noticed her blood pressure was slightly high, so they made a decision. Lower it to 120/80. At first, everything seemed fine. The numbers improved. The charts looked perfect. But something didn't feel right. Eleanor started feeling dizzy, especially when she stood up. She ignored it at first because she trusted the numbers. But those numbers were about to change everything. If you've ever experienced something similar, comment the number 1 below. As weeks passed, Eleanor's medication was increased. Her blood pressure kept going down, closer and closer to 120/80. Her doctor was pleased. On paper, everything looked perfect. But inside her body, something else was happening. Every time she stood up, her blood pressure dropped too fast. Her brain wasn't getting enough blood. That's why the dizziness kept getting worse. But no one connected the dots because the numbers looked good. Until one morning, everything changed. A simple moment, standing up too quickly. And suddenly, the room started spinning. Eleanor tried to steady herself, but her legs felt weak. Her vision blurred. Within seconds, she lost her balance. And then, she fell. Hard. The impact was severe. A fractured hip. For someone her age, this wasn't just an injury. It was the beginning of a dangerous chain reaction. Pain, hospitalization, loss of mobility, all triggered by a moment that seemed so small. But here's the truth. It wasn't just the fall. It was what caused it. A blood pressure level that was too low for her body. After the fall, Eleanor was rushed to the hospital. Surgery was required. A long recovery ahead. But things didn't go as planned. Days in bed turned into weeks. Her body grew weaker. She couldn't move like before. Her independence slowly faded. Then came the complications. Infections, breathing problems, and eventually, pneumonia. Her body, already fragile, couldn't fight back. What started as a simple drop in blood pressure had now become life-threatening. Within months, Eleanor passed away. Not because her blood pressure was too high, but because it was pushed too low and no one realized the danger until it was too late. So here's the question we need to ask. Why would a perfect number lead to such a tragic outcome? The answer is simple, but rarely discussed. Because what's perfect on paper is not always safe in real life, especially for older adults. Their bodies work differently. Their needs are different. And when we ignore those differences, we create risk instead of protection. So maybe the goal isn't to chase a perfect number. Maybe the real goal is to find the right number for you. Let's break down why this happens. First, aging changes your blood vessels. They become stiffer, less flexible. This means your body can't adjust blood pressure as quickly. as it used to. Second, your body's natural sensors, called baroreceptors, become less sensitive over time. These sensors help regulate sudden changes in pressure. But when they weaken, your body struggles to keep blood flowing to the brain. When you stand up, that's when dizziness happens. Third, medications affect older adults differently. A dose that works fine for a younger person can be too strong for someone in their 70s or 80s. It can push blood pressure too low, especially at certain times of the day. And finally, the risks are different. For younger people, high blood pressure is the biggest threat. But for seniors, low blood pressure can be just as dangerous. Falls, injuries, loss of independence. So the goal isn't just lowering numbers. It's finding balance. If you're learning something new here, comment 1 below. Because this is information more people need to hear. Now let's look at what the research actually says. One of the most important studies is the SPRINT trial. It focused on adults over the age of 75. At first, the goal was aggressive, to lower systolic blood pressure below 120. And yes, it showed some cardiovascular benefits. But here's what many people miss. The same group also experienced higher risks. More dizziness, more fainting, more falls. Other studies, including data published in JAMA, tell a more balanced story. For many older adults, the safest range is not below 120. It's often between 130 and 140, because this range protects the heart without starving the brain of blood flow. In other words, slightly higher doesn't mean dangerous. In many cases, it actually means safer. Let's consider a few different examples. Harold is 82. He has a history of heart disease. For him, keeping blood pressure closer to 130 may reduce his risk of stroke. Now take Margaret. She's 79. No heart disease. But she experiences frequent dizziness. If her blood pressure drops too low, her risk of falling increases dramatically. So her safe range might be closer to 140. Then there's Ruth. She's 85 and quite frail. For her, pushing blood pressure too low could be extremely dangerous. A slightly higher number may actually keep her stable. And finally, William. He's 76 and still very active. Exercises regularly. Strong overall health. He may tolerate lower blood pressure, better than others his age. So what does this tell us? There is no single perfect number. Each person is different. Each body responds differently. And the safest target depends on your condition, your lifestyle, and your overall health. That's why personalization matters, more than any guideline. Now let's quickly clarify something important. Blood pressure has 2 numbers. The top number, systolic, measures pressure when your heart beats. The bottom number, diastolic, measures pressure when your heart rests. For older adults, the top number matters more because it reflects how hard your heart is working to push blood through stiff arteries. But the bottom number is just as critical. If it drops too low, your organs may not get enough blood, especially your brain. That's when symptoms appear. Dizziness, confusion, fatigue. So it's not just about lowering the top number. It's about protecting both. If this makes sense to you, comment 1 below. When blood pressure drops too low, your brain is one of the first organs affected. It depends on a constant flow of oxygen-rich blood. If that flow is reduced, even for a short time, you may feel lightheaded or confused. Over time, this can impact memory and cognitive function. But the brain isn't the only concern. Your kidneys also rely on steady blood flow. They act as filters, removing waste from your body. When pressure is too low, this filtration process becomes less effective. Toxins can build up, and kidney function may decline. So while lowering blood pressure is important, going too low comes with its own risks. Balance is everything. So what blood pressure should you aim for? Here's a general guide based on age. If you're between 65 and 75, a systolic range of 130 to 140 is often considered safe. If you're between 75 and 85, that range may shift slightly higher, around 135 to 145. And for those over 85, a range of 140 to 150 may actually be more appropriate. Now remember, these are not strict rules. They are starting points. Your ideal number depends on your health, your medications, and how your body responds. So instead of chasing perfection, focus on stability, because the safest number is the one your body can handle comfortably. Here's a simple way to test if your blood pressure is too low. It's called the standing test. First, lie down and rest for 5 minutes. Then measure your blood pressure. Next, stand up slowly. Wait about 1 minute. Then measure again. If your systolic number drops by 20 points or more, this may be a warning sign. It means your body is struggling to maintain stable blood flow. You might also notice symptoms: dizziness, lightheadedness, blurred vision. These are signals you should not ignore because they increase your risk of falling. And falls, as we've seen, can lead to serious consequences. So don't just rely on one reading. Pay attention to how your body feels, because numbers alone don't tell the full story. So how do you find your ideal blood pressure? Here's a simple 7-step approach. Step 1, measure regularly. Not just once, but over several days. Step 2, track your symptoms. Notice how you feel at different levels. Step 3, test sitting and standing. Watch for sudden drops. Step 4, review your medications. Some may lower pressure too much. Step 5, consider your lifestyle. Diet, hydration, and activity all matter. Step 6, talk to your doctor. Share both your numbers and your symptoms. And finally, step 7, adjust gradually. Avoid sudden changes, because your body needs time to adapt safely. Remember, this is not about hitting a perfect number. It's about finding a range where you feel stable, clear, and strong. That's your true target. Let's address some common questions. First, isn't lower blood pressure always better? Not necessarily. Lower can reduce heart risk, but too low can increase fall risk. It's about balance. Second, what if my doctor told me to aim for 120? That may still be appropriate for some people, but guidelines are general. They don't always account for individual differences. That's why your personal experience matters. Third, what symptoms should I watch for? Pay attention to warning signs: dizziness when standing, feeling faint, unusual fatigue. These may indicate your pressure is too low. Fourth, should I change my medication? Never adjust anything on your own. Always speak with your doctor first. But don't just bring numbers. Bring your symptoms too, because both matter equally. And finally, is this something I should worry about? Not worry, but be aware, because awareness is what helps you stay safe. So here's what you need to remember. 120 over 80 is not a universal target, especially as you get older. Your body changes, your needs change, and your blood pressure target should change too. Don't chase a number just because it sounds perfect. Chase what feels stable, what feels safe, because the right number for you is the one that keeps you standing, clear-minded, and independent. Now I want to hear from you. What has your experience been? With blood pressure? Have you ever felt dizzy after trying to lower it? Comment below and share your story. And if this video helped you see things differently, make sure to like, subscribe, and share it with someone who needs to hear this, because this information could change a life.